My disclosure is that a lot of this is politics and there's legislation, and I just want to make it clear, I'm only speaking on behalf of myself, not my employer. I'd get in big trouble for doing that. The university doesn't take positions on a lot of this legislation. It may represent views of like the California AAP or CMA or those, because I did testify on behalf of them. And that I am on the Speakers Bureau for Sanofi Pasteur and Merck vaccine manufacturers, and the honoraria per our division policies paid to the university, not to me. So what I'm going to talk about this morning is vaccines and public health, which we're all familiar with, and also how vaccines affect individual health. I want to talk about the personal belief exemption rate, specifically in California, and then talk about the changes of immunization policy related to personal belief exemptions in California. First, a few years ago, where we had AB 2109, which I'll explain, and then the most recent legislation, SB 277. And then I want to talk about the tactics that were used during this fight and the reaction to that, as well as looking forward some of the implications of this legislation. So I think I took this slide from Jim Cherry years ago, which you've probably seen. And this is this great story we have with vaccine preventable diseases. All these vaccine preventable diseases, the number of cases that occurred in the US before we vaccinated, the number of cases provisionally reported for last year, and the percent decrease, which is most dramatic, of course, for smallpox, which we've eliminated so that we don't even need to vaccinate against smallpox anymore. Diphtheria way down, measles and mumps more than 99% reduced. Pertussis we're still concerned about. We have an imperfect vaccine, and yet we still have more than 85% reduction in pertussis cases. No paralytic polio, rubella and congenital rubella syndrome way down, and tetanus and H. flu type B disease way down. So these are tremendous public health successes, so it's not surprising that the CDC, when they looked at the 10 greatest public health achievements of the last century, that they would put vaccination number one. When they looked at the 10 great public health achievements of the first decade of this century, that the first one that they list is vaccine preventable diseases. So we know that vaccines work, we know that they're a great benefit, but they only work if we give them. And so about 15 years ago, the CDC did a literature review to look for evidence-based practices that would result in high immunization rates. And one thing that they looked at was the school requirements that we have for immunizations, that immunizations are required for school. And they looked through several different studies to evaluate this, and they came to the conclusion that school requirements requiring vaccinations for kids to go to school resulted in improved vaccination coverage, resulted in reduced disease rates, and that most importantly, that these effects were generalizable. So they would apply across different schools, different socioeconomic status, different races, different ethnicities, and different ages. So these are one of the most effective mechanisms that we have to maintain high immunization rates. And yet, when you look at vaccination coverage in the US, when it's checked for school, this is for kindergarten, you can see on this map of the US, California is the darker blue color, and that's the second highest tier of exemptions for immunization, where parents choose not to vaccinate their children. And so this can be a problem when parents are choosing this. If you look at the medical exemptions in California, the permanent medical exemptions in yellow, those are the true contraindications to vaccination. Those are at a low rate, less than 0.5%, and really there's no trend over the last 35 years. However, if you look at the personal belief exemptions in the lavender bars, there's this clear and dramatic increasing trend, more than 6 times increase. And it appears to be just going up and up and up. And this is really a concern because this can have effects for those who opt out of immunization. So this was explored more than 15 years ago, looking at the association with personal belief exemptions for immunization and certain diseases. So in this study, what was found that children who opted out of immunization were at over 20 times increased risk of developing measles. And children who opted out of immunization were almost 6 times increased risk of getting pertussis. So it really has effects for the individual themselves. This was recently reviewed in JAMA in March of this year, and they updated this, and they found very similar results. Another study from Colorado Kaiser looked at parents refusing pertussis vaccination for their children, and what they found was more than 20 times increased risk of pertussis for those children. So it does have these effects overall, but I want to talk about a few cases where it can be even more dramatic. So, for example, with Haemophilus influenza type B, this has been tremendously successful, our vaccination program. First, we had the plain polysaccharide vaccine, then the conjugate vaccine, first for use in toddlers, then infants. More than 99% decrease in invasive Haemophilus influenza type B disease in the US. So that's a great success story. And yet, a few years ago, the MMWR reported invasive H. flu disease in 5 kids in Minnesota. And when you looked at these 5 children, 3 of them received no doses of Hib disease because their parents refused vaccination for them. They exempted them from vaccination, and tragically, one of these children died from Hib disease. And another example that can have tragic consequences is chickenpox. So varicella, chickenpox, the chickenpox vaccine was introduced in 1995, and we've had gradual reduction in chickenpox cases in the US. In the pre-vaccine era, about 100 people died every year in the US from chickenpox. About half of those were previously healthy children. And you can see in the dark line at the top with the round circles, that's the target age for immunization, those less than 20 years of age. And we've virtually eliminated mortality due to varicella in this country because of our vaccination policies. And yet, if you refuse to have your child vaccinated against chickenpox, then we end up with more than 8 times increased risk of varicella. And then the CDC did report a few years ago the death of an unvaccinated, previously healthy adolescent. So again, this can have tragic consequences. And this morning I was talking with Debbie Lehman and Paul Krogstad about this chickenpox parties that continue in Topanga Canyon and chickenpox cases that occur. So as subspecialists, we see the bad outcomes of these vaccine preventable diseases, whereas sometimes parents think they're mild. Now, we've talked about the effect on the individual who chooses not to be vaccinated or parents who choose not to vaccinate their individuals, but we know that vaccines don't work 100% of the time, so this can have effects also for those who are vaccinated. So in this study that looked at religious exemptions for immunizations in New York, you can have a personal belief exemption or a religious exemption or a medical exemption. I myself would consider a religious exemption to be a personal belief exemption. But in this study, they looked at religious exemption for immunization and risk of pertussis in New York. And what you can see on the horizontal axis is that that's the increase in immunization rate by county. And on the vertical axis, the pertussis incidence within that county. And with increasing exemption rates within counties, you end up with increasing rates of pertussis incidence. So that's not surprising. Less people immune, more disease. But what I find interesting with this is if you look at these high exemption counties and you look at the increasing incidence of exemptors on the horizontal axis, you get increasing rates of pertussis in vaccinated individuals within these counties. So the vaccinated individuals who are vaccinated with a vaccine that does not work 100%, they're in these counties with more exemptors. That means there's increased risk of the exemptors getting disease, which means there's increased risk of exposure to those who are vaccinated, and then that will eventually result in increased disease in those who are vaccinated too. So choosing not to vaccinate your child, not only will it affect the health of your child, but it will affect the health of your whole community, including those who choose not to vaccinate. And one of the issues that means you have to look at these disease rates at the county level is when we get exposed, we don't get exposed over the course of a whole country or over the course of a whole state. We get exposed in our own localized communities. And that's why the exemption rate within a community is even more important than these more large statewide rates. So these maps of California show the clustering of parents who choose not to vaccinate their child. So the clustering of personal belief exemption. The darker red color is higher rates of personal belief exemption. And you can see over the past 15 years that not only do these cluster, but we're getting more areas of the darker red color, more areas of these concentration of personal belief exemptions. And they do tend to cluster in coastal communities and high-income communities, as well as some rural communities where people feel that they don't like the government telling them what to do, or maybe they're leading an alternative lifestyle and also don't want the government telling them what to do. And so the reason that we have these clusters and high rates of personal belief exemptions in California specifically is it has been relatively easy to get a personal belief exemption in California. In this study that looked at states by state and looked at how easy it was to get an exemption, for those states that it was easy to get exempt from childhood immunization, meaning maybe the parent just had to sign a form, there's increasing rates of exemptions over the years. If you make it a medium exemption policy, so maybe the parent has to sign the form and the healthcare provider has to sign a form, one more hoop for the parent to jump through, you can see that lowers the exemption rates, although they still are increasing over time. If you make it a difficult exemption policy, so for example, maybe you only allow medical exemptions and don't allow personal belief exemptions, or maybe the parent has to not only get that form signed by the healthcare provider, but they also need to get it notarized, then you can see it's lower rates of exemption in these states. So it's really the vaccine policies that one has within a state that can really affect how many personal belief exemptions that you end up having. Now, this is a form from Washington State that was instituted a few years ago that we in California thought was a really good idea. In Washington State, they had increasing rates of personal belief exemptions. They were very concerned about this, and they thought, what can we do to approach that? And they came up with the idea to go from an easy to a medium state in terms of difficulty obtaining an exemption. So what the parent had to do, instead of just signing a form, now the parent signed the right-hand part of this form. They would have to bring this to their healthcare provider, discuss vaccine safety and effectiveness, and then the healthcare provider would sign the left-hand side of the form. And they put this into effect for the 2011-2012 school year, and they saw a decrease in their exemption rate from 5.9 to 4.5%. And they were pleased with this, so 25% decrease in the exemption rate. Well, we in California thought this was a good idea, and we've got increasing rates in California, and this is proven to work in Washington, so maybe we should do this in California also. So several of us got together, not just me, but Coalition, American Academy of Pediatrics in California, the Health Officers Association in California, the California Medical Association, American Academy of Family Practice in California. So a wide variety of a big coalition of people who cared about children's health and said, let's get a bill passed by the legislature and change policy in California. And we identified a legislator, Richard Pan, who is a colleague of mine. He's a pediatrician at UC Davis, and he ran for the assembly and won, so he represented my district. And he's a pediatrician, so we could explain this to him, and he would understand the importance of carrying this legislation. And he did, and we were pleased. The hearings were quite contentious. These hearings are kind of like a courtroom. There's the committee chair, who's like the chief judge, and then the committee members, who are like associate judges, and the author presents the bill, the rationale behind it. He has witnesses in support who have an allotted time to talk. Then there's witnesses in opposition. And then there's the Me Too's, people who don't give substantive testimony, or they're not supposed to. They're just supposed to say, I'm a concerned citizen and I want to be involved in democracy in California and be involved in the legislative process. And I live in so-and-so's district, or I'm the mother of 3 children, and I oppose or support this bill. So I'll show you some example of the Me Too's also. And then they vote on the bill. Now these hearings were quite contentious. A lot of people who oppose vaccination came out. This is the first hearing that it was heard at, the Assembly Health Committee hearing. At each committee hearing, if you can block legislation at any one of the committee hearings, then you can block the bill. So the public comes out in force if they're against it to try to block the bill. So this is Dr. Pan standing up, presenting at the first committee hearing. That's me. I was there too, and I was an expert witness in support of this bill. I thought it was a good idea, and we did get it through the hearings. We did get it to pass the legislature, and the governor signed the bill. We were pleased, and this went into effect. So this was AB 2109, and this changed policy in California so that for parents who wanted a personal belief exemption for their child, instead of just signing a form themselves and submitting that to the school, they had to go to their healthcare provider and discuss vaccinations, the risks and benefits of getting vaccinated, the risks if they choose not to vaccinate their kid for vaccine preventable diseases, and that those children may communicate those diseases to others. The healthcare provider would fill out the top part of this form, the parent would do the bottom part of the form, and then submit it to the school. This went into effect in January 1st, 2014, and you can see in 2014, 2015, we had a very similar experience to the one in Washington State. So this was successful, and we were pleased, and maybe we should have stopped there because this was a successful intervention. But we looked to Washington again, and we looked to see what their experience was. And you can see with their form that went into effect 2011, 2012, that did have an effect, and it was a sustained effect, but it didn't have any additional effect. So it just modestly decreased the personal belief exemption rates and didn't decrease them any further. So there was no really change past that first initial success, and that was disappointing. And then something else happened at the end of 2014, and that was the measles outbreak in Disneyland. And with this measles outbreak in Disneyland that started in December of 2014 and then continued throughout the US, spread throughout the US during the early part of 2015, it turned out that the majority of people who ended up getting measles were not vaccinated. And this we're all familiar with all the press coverage that this received. If you looked at those who were unvaccinated, you can see over 40% were not vaccinated because of philosophical or religious beliefs, personal belief exemptions. And because this really drove this outbreak related to measles, some, not me, but some others thought that since there was increased education in this area, people were understanding this issue better, the personal belief exemption issue, how it led to disease outbreaks. Some thought maybe we should even change the personal belief exemption to make it even more difficult to be exempted from getting vaccinated. So that's what Senator Pan thought. Along with in the background, you can see Ben Allen, senator from Santa Monica. They thought that they would get rid of the personal belief exemption. And so they introduced this bill in February. This was interesting for me personally because I got a call from Senator Pan's office, said, would you come down for the press conference for this immunization bill that we're introducing? And I admit, for me, I'm like, sure, immunization, that's my thing. I'd be happy to support this. And they tell me what it's about, and I'm probably doing email at the time I'm talking on the phone and not paying attention. So I didn't even know what the bill was about, really. So I go to this press conference, and he says that it's about getting rid of the personal belief exemption. And I'm like, huh, what? I'm thrown for a loop. Really, you can do that? People would consider doing that? Because that's a big step. Because during the hearings for AB 2109, we all talked about maintaining parental rights, that they could still opt out. They just have to jump through a hoop. Now there was no hoop to jump through for the parents. So I go to this press conference. You can see that the angle for trying to convince people this is the right thing to do had to do with mothers and children, had to do with the silent majority, those who believe mainstream medical advice and vaccinate their children, that these mothers wanted to make sure that their children weren't at increased risk of being exposed to disease from exemptors. So by now you can see me at the press conference, right? That's me. That's my right ear, anyway. So I go to this press conference, and I'm thinking to myself, I have to do some soul searching. Do I support this policy, which many think is draconian, not to allow children to go to school if they're not vaccinated? And so I went and researched this myself to come to a conclusion. And one thing I looked at was this article, which looked at justifying when you can justify having a mandate. And in terms of having a vaccine, if you can have a vaccine to mandate for kids to go to school, the author had 3 criteria that they set aside. One was that there needed to be clear medical value of this intervention to the individual. And I think all of us in mainstream medicine can agree that vaccines have clear medical value for the individual. The second thing was they said we need to have clear public health benefit of the intervention. And I think clearly vaccines have been fantastic for public health. So there's no question on that one. And the third criteria that they put was this needs to be the only way to obtain these medical and public health benefits. For this one, I think you could quibble, because I think we could say that we could always do a better job with education of individuals and the public about the benefits of vaccine. We could clearly communicate more about the risks of vaccine. I think we could do that. You could also argue that we've really spent an extraordinary amount of time already doing that, and we've reached our limit, and we can't do any more communication in this regard. So in my view, we've reached 2.5 of these 3 criteria. So I went back and did some more thinking, and the thinking involved my father-in-law. And my father-in-law died 6 months before this vaccine was introduced. And so that gave me time, of course, for reflection about his life, his philosophy, his career. He's an oncologist, and one of the things, one of his roles he played during his career was he was Surgeon General during a conservative administration. And during this administration, he looked at the data, is what he did when he made his decisions. He did not look at the political, he just looked at the data, let the science speak. And so he advocated for decreasing environmental pollution, for removing carcinogens from food additives, for improving drinking water quality, for recognizing the influence of media violence on children's behavior, and his main issue was decreasing cigarette consumption. All of these policies, all of these attitudes and policies that he's advanced during his career, at that time, they were very controversial. In retrospect, we all agree that these are correct policies and they're mainstream policies. But one of the other things that he advocated for was decreasing exposure to secondhand smoke. And he was attacked viciously by the tobacco industry, who wanted him removed. And the tobacco industry, when he said we need to limit secondhand smoke exposure, came up with the Smokers' Bill of Rights, because if you limit secondhand smoke exposure, that would infringe on smokers' rights to enjoy a good cigarette. And he responded with the Non-Smokers' Bill of Rights, which basically said that non-smokers have the right not to be exposed to noxious, cancer-causing chemicals, and so they would have the right to not be exposed for the adverse effects from individuals choosing what they're choosing. And when I thought about that, that's what really changed my views about this bill, because I thought that's true. These parents who choose to vaccinate their children, why should their children be put at increased risk for the minority of children who aren't vaccinated, whose parents choose not to be vaccinated? That's not fair to them. And that's really what changed my mind, along with this book, which I highly recommend, On Immunity by Eula Bliss. It's easy to read. My wife got it for me. She thought it would help me clarify my thinking, and it did. And I took some of my testimony from that too, and so that was useful for me. So the Senate Bill 277 was introduced, and when it was introduced, the idea was there are 10 diseases in the Health and Safety Code already, and children need to be immunized against these in order to go to school. This would change it so that children would need to be immunized against these. If they're not immunized to go to school, then and they don't have a medical reason for not being immunized, then they can't go to school. And this would apply to public schools, private schools, charter schools, and parents could homeschool if they wanted to do that. That's up to them. That was the choice that parents had. So there was a lot of committee hearings, quite contentious. I gave expert testimony at some of them. There's also the Me Too's, and I'll show you some of that testimony, just to show you some of the tactics that occurred. The bill starts, and it looks like it's going to be really confusing when it starts because it has to go to different committees. But we had some twists and turns with this bill that were even more confusing and things that I had never seen before at the state legislature. And so it was a really interesting process to follow. These are all the different actions that occurred with the bill over the 4.5 months of the bill. Referred to this committee, re-referred, referred again. It was extraordinary. Most bills go to 1 or 2 committees. This one went to many more. So here's some testimony from the Me Too's and against.
Hi, I'm Caroline McIntyre. I'm 15. I am a freshman at a Catholic high school, and I am a sister to a severely vaccine-injured autistic brother, and it hurts me that you would even introduce this bill. I strongly oppose this bill.
Joyce Eden, Cupertino, grandmother. I oppose this bill. The measles vaccine, do you realize, it can be transmitted 2 to 4 weeks after it's been administered. It's a lie. These vaccines go into the blood.
Okay, wait, hold on. Let's stop here for a second. I am trying to be respectful to everybody. I'd like to ask that we not have any kind of outbreaks of public, comments. Keep it to name, position only. I'm trying to keep this open. Let's make sure that it's name and position only.
So we saw 3 things there. That first person in opposition, I mean, I wanted to cry when I saw her presenting. She's so heartfelt. It's very effective. And if you're a legislator, then that's going to be really effective testimony. And so, I really respect the passion of the opponents. And it also shows the misinformation that the opponents can give. The second one, and the disrespect that they have for the process. They're not supposed to give substantive testimony. The expert witnesses are. And the committee chair is the judge, and you piss off the committee chair. That's not a way to get them on your side. And this did occur repeatedly throughout the process. So it did pass out of, this was the first committee hearing in the Senate Health Committee. And it passed out of Senate Health, and it was referred to Senate Education Committee, which makes sense because it involves schools, right? So it should go to the Education Committee. And at the Education Committee, there were several objections to this. And because of this, it was not voted on in the Education Committee because it was clear that it was not going to pass. And they said, listen, you got 1 week to try to gather support. So what the proponents did during this 1 week to try to gather supports is some behind-the-scenes stuff. One thing that they did was change the committee makeup, which I didn't know you could do that. But, it was for the side I'm on, so that was okay. And then what they did also is they still needed to convince the members to support the bill. And so they talked about what it would take to get that, and what it took was some amendments. And so the first amendment they put was the grandfather clause, which meant that there would be 3 checkpoints for this mandate, and it would be preschool, kindergarten, and 7th grade. So for example, if a child is in 2nd grade, they have a personal belief exemption, nobody's going to check their immunization status until they reach 7th grade, so they don't need to be caught up on immunization until then. They're grandfathered in until the next checkpoint. And the other part, there was concern that children with special needs, children who had individual education programs, that if their parents chose not to immunize, then they wouldn't be allowed to go to school, and that would violate the education code because they needed special services. And so the special IEP part was put in, and I'll talk about that in a moment. So the vaccine bill did get the okay the second try through the Education Committee, and you can see they also note that the committee was revamped as part of that to get it through. It also then went to the Senate Judiciary Committee, and it got through that. Then it goes to the full Senate, goes and passes the full Senate, flips over to the Assembly side, where this had been kind of a circus with these hearings, and they decided they're just going to do one hearing at the Assembly Health hearing. That's the only one the public's going to go to. And they go to this hearing, and although Senators Pan and Allen were the main authors, you gather co-authors, co-sponsors along the way. And then something very interesting happened at the Assembly Health Committee hearing.
Thank you again, Mr. Chair. I guess I want to just conclude by asking you if you would consider, I've grappled with this, and I'm a co-author. I want to support this. I ask you if you would consider putting in language, not limited to, but for the exemptions to be offered in instances when a sibling or a family member has had an adverse reaction. And if there's I know there isn't a very good test for it, but if there are any genetic dispositions that...
So parents would testify and say, listen, I have 2 kids who are quote unquote vaccine injured, and I don't want my third one getting vaccinated. And this was effective testimony to the legislators. And this legislator, who's a co-author, is basically saying he's not going to support the bill, and he's a co-author. This is really embarrassing. So basically you have to take that amendment, and so the amendment gets in there that that physicians will take into medical circumstances of the child to provide a medical exemption. But now this is amended. They'll take into circumstances, including but not limited to family medical history, which is interesting because I don't think I can't think of a circumstance where I have ever given a medical exemption based on family history alone. But that's what you need to get it through the process. And so that amendment was taken, and it passed out of the Health Committee, and then it went to the full Assembly. So it made it to the floor vote. I just bring this to your attention because one quote in this article about one of the Assembly members said, children who are unvaccinated, who parents choose not to vaccinate them, they're going to end up in concentration camps or internment camps. And I just don't think that this rhetoric has any place in this kind of a discussion. I'll refer back to that again later. So it goes to the Assembly, it passes the Assembly, it's been amended, it goes back to the Senate for concurrence, and it passes and the governor signs it. So we were pleased that the governor signed this, and it does go to effect this year. So I'll talk about the implications about that, but I do want to talk some about the tactics employed. One of which was overreach on the part of the opponents. Generally, the politicians, when they attack people, they attack other politicians. They generally don't attack witnesses, either the Me Too witnesses or the expert witnesses. But if you overreach, they might.
And cannot, for economic or other reasons, homeschool. Will you be willing to remove the children and force vaccinate them as wards of the state? Will you be willing to throw non-vaccinating parents in prison? And what happens if the state does vaccinate a child whom it has removed and that child is severely or injured or dies? What will the state do?
Where in this bill does it talk about throwing parents in prison?
No, but what will you do with the parents, many of the parents who are...
No, this is, I'm sorry, but...
I'm saying that
there's nothing in this, there are enough concerns raised to kind of push it to a level. Now we're talking about putting parents in prison, I think does a disservice to those who oppose this bill. Let's talk about what's in the bill and what isn't, but I don't see any connection. There's no allegation that people are going to get put in prison. So I think you don't do yourself a service by talking about things that are not even within the contemplation of this bill.
I asked rhetorical questions. My question is, what will you do with noncompliance? I think that's a reasonable question.
That's a reasonable question.
That was my question.
To suggest that we're going to put people in prison
I don't know what you will
is
do.
not, well, that's, this is an appreciative audience, not a vocal audience, or we won't have an audience. So let me just ask the witness who's representing the opposition. It's a rhetorical question, what are you going to do? But to suggest that people are going to be put in prison, I think does a disservice to your cause. So please try to stay within the framework. You can ask rhetorical questions, but not to suggest things that are nowhere contemplated by anybody, in which all they do is inflame this discussion, which doesn't need to be inflamed further. So please.
So my philosophy as an expert witness is to not irritate legislators because I want them on my side. I also don't interrupt them. I let them say what they want to say. We talked about some of the Nazi analogies before.
Hi, my name's Julie. I'm the aunt of 4 vaccine-injured children. I think this bill is completely fascist, and until the carcinogen formaldehyde is
You're
removed.
opposed to the bill? Thank you very much. Please, name, affiliation, and position.
So this is a fascist bill. There was a protest later in May that said that if California passes this, it's going to be just like Nazi Germany. Robert F. Kennedy Jr., a well-known anti-vaccine activist, came out to California, and he said that if this bill passes, it will be a vaccine-linked Holocaust in California. I just don't think you need these kind of analogies. And in fact, there's a law about this, Godwin's law, who states that once you make a comparison with the Holocaust or with Nazis, any kind of discussion is finished, and whoever mentioned the Nazis first loses. So there were also religious overtones to this discussion.
My name is Jason Hommel. I represent God. He strongly opposes this bill. Thou shalt not kill. Vaccines kill.
My name is Wiley Drake. I'm the Congressional Prayer Conference of Washington, D.C. chairman. We sent you a fax yesterday, and if you pass this bill, we will continue imprecatory prayer against each member of this chamber. And if you don't know what imprecatory prayer is, you need to study it.
Thank you.
Well, I was in the chamber, and I didn't know what imprecatory prayer was, so I don't know. Does everybody know what that is? Okay, so I thought, gosh, you know, I know I'm not that religious, but I don't know what imprecatory prayer is. So I'm sitting next to the chiropractor. They were opposed to it, and I asked him, I said, do you know what that is? He's like, no. So I looked it up. So imprecatory prayer is a prayer asking God to kill, maim, curse, or send into eternal damnation or otherwise harm your opponent. I didn't really like that. I mean, there's a couple other threads. One is that the CMA lobbyist felt that she was being stalked. I also received some letters that were slightly threatening, mostly not threatening harm, but threatening my soul. Andrew Wakefield, well-known discredited scientist who tried to link MMR vaccine with autism, came to California and said people need to come up to Sacramento to protest this bill, and they need to act like pitchforks and torches. And this violent rhetoric, I don't think there's any place for that.
Dr. Don Hart, Marin County, epicenter of noncompliance. I strongly protest the chemical molestation of children and the establishment
Thank
of
you.
medicine
No,
as an establishment.
let's stop right now.
Chemical molestation?
Against vaccination. This bill will be coercive, and parents will be vaccinating their children under duress, invalidating any notion of informed consent. In employment, lack of consent is forced labor. In military service, it's conscription. In contracts, it leads to invalid contracts. In intimate relations, it's called rape. And in medical treatment, it's battery.
Whoa, wait a minute. Rape's a loaded word, and as the chair of the Legislative Women's Caucus, I don't take the use of that word lightly. So,
I don't either.
So, well, to analogize this to rape, I think is a little bit off the rails.
Well,
so let me ask you a question,
sure.
if I may. I want to bring it back.
She's so good at bringing it back. But really, I mean, rape, I mean, the words, the overreach that was used, the rhetoric that was used is so violent. It was too much. And I'll just do one more, and you might recognize one of the witnesses in opposition who is affiliated with UCLA.
Thank you. I just, again, because this is like bad information that is coming out and directed to me by my constituents, and I just want a yes or no. Is there an exemption anywhere in this bill or any other bill for undocumented immigrants to not have to have vaccines to enter school? Does anyone know of this, Dr. Pam? Are you aware of such exemption in your
There's no
bill?
exemption.
Thank
There's
you.
no made reference made to undocumented.
Do the opponents know of such exemption?
No.
Okay, I want to be clear for those watching at home. There is no exemption for immigrants who come to this country, by the way, who are vaccinated in their own country because they see the devastating effects of these diseases, to enter our schools without vaccinations. No, I'm sorry, but there is a bunch of misinformation out there, and it is irritating and beyond belief to me that we're going to have this hearing and not address the very specific issues that are floating around on Twitter and in the media and in phone calls that make no sense whatsoever. We can debate this bill, but I want to make sure we're debating this bill.
Wait, the sergeants will remove this member of the public. Sergeants, please.
You can't do that.
You've done a great job moving through your questions. Let's go to the next one, please.
I'd like to know, because I heard something about parents being thrown in jail. Is there anything in this bill that would suggest a parent would be thrown in jail because they did not vaccinate their children? Dr. Pan?
No.
Is there anything, I'd ask the opposition, is there anything in this bill that suggests that a parent would be thrown in jail for not vaccinating their child?
Well, it's illegal to have a truant child, and it'll be illegal to try to send your child to school without vaccines. And I'm not quite sure how an undocumented alien documents vaccinations from the country from which they came. I'm very serious.
I'm sorry, but last I checked, when they enter school, they also have to show their immunization records. I don't know if you don't take care of those kids, but they're actually kids in my district. So I just want to be very clear that they have to still show an immunization record to enter our schools.
Well, of course they do, but
Okay,
what I
thank
was
you.
asking,
Thank you.
I don't mean to be argumentative, but how do they document that they received vaccines before they came here?
Other countries also document vaccines. I know it's incredible. It requires it for school as well. And quite frankly, so I just want to be clear, though, they have to show the school something prior to entering the school.
All right.
That was my question.
So, Member Gonzalez, if you could just ask your questions, and if someone has an answer, do your best to answer it, and let's go to the next.
She's my hero. I mean, she's articulate, she gets to the point, she talks to things, and she just, there's all these rumors floating around, and the opposition is trying to defend them, but really can't. So I think this kind of overreach by the opposition really irritated a lot of the legislatures. It really didn't help them out very much. So I want to talk a bit about this new law, SB 277. It went into effect January 1st of this year, but really the rubber doesn't hit the road until immunization records are checked, and that's going to be in the fall when children enter school in the fall. So again, it's going to be preschool, kindergarten, and 7th grade. Those are the children that it's going to affect. The California Department of Public Health is sending this out to school districts. They share this with parents. We don't want surprises. No shots, no records, no school, unless there's a medical reason for your child not to be vaccinated. There are possible adverse consequences, efforts to repeal the measure, the recall of the bill author, increased conditional school entry, pressure to delay implementation, the individual education plans, which I think there's been some misinterpretation of those, and then increased permanent medical exemptions, as well as parents might just choose not to get their kids vaccinated and homeschooled. So I'd like to address just a few of these. The people who were against this did have signature collection to try to put this on the ballot, and they failed pretty dramatically. So they had less than 2/3 of the number of signatures needed. So it will not be on the ballot. They did try to recall Senator Pan, and they fell well short in terms of their signature gathering for that effort also. This group, A Voice for Choice, you can tell from their website, you probably can tell where they stand on public health and mainstream public health and medical recommendations. They sent this letter out to several school districts, and they basically tell school districts that if you implement this law, then there's going to be litigation. So it's a threat of litigation if they implement this law. And this has been sent out to several school districts asking them to delay implementation. So this was from Northern California, Hollister, and then there's also the issue related to IEPs. So the Department of Education in California has declined to take a stand regarding the IEPs. And the issue is this: if a child has an IEP that says, for example, they need speech therapy twice a week, does that mean that they go to school full time and get their speech therapy twice a week? Or does that mean that they don't go to school except Tuesdays and Thursdays from 3 to 4 to get their speech therapy? And I remember what the intent of this was. Other people remember it differently, but the Department of Education is not clarifying this. School districts need to interpret this on their own. And so, for example, LA Unified is interpreting this in the broadest possible terms, that if a child has an IEP, they can access all school services. That's not the way I interpret it. And in fact, the California Department of Public Health has come out with clarification, which basically says what's written in the law, that if a child has an IEP, they should continue to receive all necessary services identified in the IEP. Now, if the IEP says that that child should be mainstreamed, then sure, the child should go to all the classes. But this is something that I'm sure is going to end up in the courts. Then there's the issue about the including but not limited to family history for the medical exemptions. And I have seen now some practitioners writing a medical exemption that this is the reason that they're giving it. It might sound good clinically, but we're sure that medical exemptions are going to rise. On this website, this doctor advertises that you see her and you can learn how to successfully ask for a medical exemption. So, and on this website, they actually tell how much you can charge, $120 for each medical exemption. Just bring your kid to us. I have heard anecdotally that some physicians are charging $1,000 to get a medical exemption. So parents want them, there's a business there. So we'll see how much the medical exemptions increase. I'd just like to mention this measure. This was introduced that said that licensed physicians might be insecure about giving medical exemptions. And so because they might be insecure and vulnerable to lawsuits and discipline by the medical board, that this bill will remove any lawsuits related to that or discipline. This is one of the more ridiculous bills that I've heard of. I think if physicians are uncomfortable giving medical exemptions, then they should not give them. And I was raring to go to testify against this one, but this got pulled because it was not going to pass. Finally, I want to look at the grandfather clause of this. So the grandfather clause, what this means, this was a letter to JAMA Pediatrics a couple months ago, and what it shows is that kids are going to be grandfathered in, and so it's going to take until 2022 for the full effect of this to get to the full impact of this measure to occur. And then this was in Lancet Infectious Diseases this month. I thought this was interesting. This looked at the 2008 measles outbreak in San Diego and looked at different interventions that could have occurred that might have prevented this outbreak. This occurred in a school where this started was a school with a 30% personal belief exemption rate. And out of all the interventions that they looked at what the intervention would have, the effect of that intervention on the infectivity. And eliminating the personal belief exemption would decrease the infectivity by about 2/3. So decrease the risk of outbreaks by about 2/3. So it's one of the easiest and most effective measures to decrease the risk of school-based outbreaks. People might be aware of this movie directed by Andrew Wakefield in order to exonerate himself, and this has been making the rounds. It started a week ago Friday in Sacramento, which was an opportunity for Andrew Wakefield and others to come to Sacramento to publicize the movie, and they took advantage of that to visit the legislature on Monday of this week, where they went unannounced to Senator Pan's office to try to confront him, and he was having none of that. And as he left the office, they filmed him leaving the office, and so they say that he was afraid, that he ran away from them. So, these kind of efforts are going to continue, and these kind of tactics, which I think are frankly immature, are going to continue also. People may be aware of this editorial in April Pediatrics, where the authors say there should not be any vaccine mandates for any vaccine except measles. Measles should be the only one that should have a mandate. This didn't make any sense to me. There was a rebuttal in the same issue, in the April issue, which made more sense to me. So you still have a lot of debate about vaccine mandates. And in this February piece in Journal of Pediatrics, the authors argue that vaccines are proven safe and effective, and if parents choose not to follow mainstream advice like this, that is a form of child neglect, and that those parents should be reported to Child Health Protective Services. So you can see it on sort of both sides of the debate. So I'm just going to end here. I just want to summarize that personal belief exemption rates are tied to community and individual health also. That SB 277 has eliminated the personal belief exemption in California. We are yet to see the effects of that. And then I'm in Sacramento, so that's one of the reasons I got involved in advocacy. But I would love if anybody here, if you're a student, a resident, a fellow, if you're attending, if you want to get involved, you don't have to be in Sacramento. You can testify or not testify. There's other stuff you can do. But I would love for others to be involved in advocacy, either at the local, state, or national or international level. I'd be happy to talk to people about that. Thank you.